Hear me? All right. Let me start with a quick prayer. Om Namami Dhanvantare Devam Surasurahi Vandita Pada Padmam Loke Jararuk Bhayamrityunasham Dhata Ramesham Vidita Ushatina. All right. So today we're doing a class on the health and wellness of women. So basically, we're going to talk about the menstrual cycle, about different kinds of things that we can do to help a person combat menstrual issues. Plus, we're going to talk about postpartum and menopause, and all. Basically, we're just going to talk about the health and wellness of women and different kinds of Ayurvedic things that we can do. So today we're going to see Ayurveda and women, classification for women, the natural cycle, menstruation, the Ayurvedic aspect of it, premenstrual syndrome, and how doshas are related to premenstrual syndrome, birth control, postpartum care, and then perimenopause and menopause. So Ayurveda and women. In Ayurveda, women are are basically a representation of Mother Nature. So, with different kinds of work and with different kinds of roles that women take on, what normally tends to happen is they kind of start burning their energy and burning their health, and they kind of need certain practices that will actually help support their lifestyle and will help ensure that they remain healthy, because women kind of juggle more things than men do, right? So a woman's the life right from the time she's born, there's a very close relationship with the different doshas and with how different cycles kind of affect her menstrual cycle. So from the time she is born till she hits puberty, she has a lot of kapha in her, and then from the time of puberty till her perimenopausal cycle, till that phase, she has a lot of pitta, and then from her perimenopause, menopause, and then so forth, she has a lot of vata. So basically, there are different cycles that kind of combine along with the menstrual cycle, like the night and day cycle, the moon cycle, the lunar month, the lunar cycle, the solar cycle, different seasons, different ages, how different doshic cycles, everything kind of has a relationship with the cycle of feminine energy. So this is how classification of women, this is what happens. So irrespective of what your dosha is, what your prakriti is at the time of your birth, everybody goes through this different phase where you have kapha when you're born till you're a young adult. You have a lot of kapha, and then you go through a pitta phase, and then finally you have a vata phase. So this is the same thing that happens with women also. This is the same kind of cycle that happens in relation to the age and to the doshas. Now, based on how one sees things, about how one's manasika doshas are, whether a person is sattvic by nature, and whether she can find peace and everything, whether she's tamasic, where she has this where she keeps thinking about things of the past and she's not ready to let go, or whether she's rajasic, where she has an aggressive state of mind, based on the different kind of personality, that manasika avastha also has an effect in terms of the menstrual cycle and the menstrual phase that a woman has. Now, all these things, the physical doshas, the doshas according to the age of the person, the doshas that kind of peak during a day, in the early hours of the day when there's a little more kapha, in the middle portion of the day when there's more pitta, and towards the end of the day when there's more vata. So even during a day you have different peaks of different doshas. And now your your basic lifestyle, your spiritual life, your work life, your the home life, your basic lifestyle, and the manasika doshas, all these will affect the cycle within us, will affect the kind of today we're going to talk in terms of a woman's menstrual cycle. So all these will affect the cycle, will affect the menstrual cycle, will affect the cycle of your life. So this is a general classification based on doshas. Now, a woman who is vata, she is, this is generally the physical. This is how your physique would be. This is, this just kind of gives you a glimpse of how your mental, physical, and emotional status is according to the dosha. So if you're vata, you're more athletic and creative, thin, tall, or short, but you generally have thin arms and legs are very thin. Very, very little fat tissue is seen in a vata person. There'll be a lot of dryness, be it your skin, be it your hair, be it your vagina, your stools. So there's basically a lot of dryness that is associated with vata. There's weak circulation. So if any one of you are vata and you just touch yourself, you'll realize that you're always cold, irrespective of what the weather is outside, irrespective of what the weather is inside your home. You always have that, your body has that little bit of that your skin is always cold. So this is a very specific vata trait. Menstruation in a vata person is irregular, and there can be imbalances, and normally the bleeding also wouldn't be as much as a pitta. The bleeding would comparatively be less. So there would be disorders related to the nervous system like anxiety, mood swings. They tend to worry a lot. They're just basically very anxious. Learning disabilities can be there. During the menopausal phase, normally whatever vata symptoms you see in you will actually be more. So that kind of holds good for all the doshas. When a person goes through the menopausal phase, they tend to have like a multiplied symptom that's seen. So normally if the vaginal dryness is there in a menstruating woman, when she hits a perimenopausal phase, she would experience excessive vaginal dryness, and that would lead to itching and lead to scars, because she would have invariably scratched, or she would have kind of hurt herself in the process of scratching. So whatever symptom you see kind of is more pronounced during the perimenopause and menopausal phase. So normally for a vata person, it's advisable to have 8 cups of warm water with a little bit of, you can mix a little rose water, or you have soups, you have teas, and so on. Now for a pitta person, a pitta is generally middle in size and height, so they would generally be of average build. There would be an average amount of fat tissue. The skin would have acne, and even adult acne. So teenage acne is a very common thing, but a person who's very pitta can even have adult acne. The complexion is very fair, but they kind of get burnt easily. They sweat easily. They react to light very easily. So they kind of, they have that photosensitivity. And their skin is generally warm, and even in general they feel very warm, and even when they're not having a hot flash, they kind of have that feeling of heat, and they're very warm to touch. One common thing that most of these pitta people have is they have cysts very, very easily. So it can either be like a small cyst that is formed anywhere in the body, or it can even be something like a sty that's there in the eye, or something that's very, very small, but a pitta person generally has that very often. and they have this tendency to react immediately when there's a problem. So if they get angry, or if they're worried about something, or if they're anxious about something, they kind of react almost instantly. So they don't just sit there, worry and think about it and decide how to react. Before they kind of decide what they're going to do, they're already out there and they've already done it. Now, a pitta person will normally have several bowel movements a day, because the pitta is really high in the stomach, and then they tend to digest very fast. They have better metabolism, and they tend to have more bowel movements. And at certain points, because of this high pitta, they kind of are very prone to acidity or acid reflux. So normally, if you have this habit of eating out very often, if you go out with a person who is very pitta, and if both of you order French fries and dip it in tomato sauce and have it, a pitta person would actually start experiencing an acid reflux almost instantly, compared to a person who is either kapha or vata, because they have that acidity and acid reflux because of the pitta. So for a pitta person, you advise them to drink a lot of water, which is not hot. So you boil the water, you allow it to cool, and then have water that is room temperature, and drink a lot of water during your cycle. Now, for a kapha person is normally larger than a vata and a pitta person. They have thicker arms, they are stronger, they have thicker bones, and the body is generally, there's a lot more fat that is there in a pitta person. In a kapha person. A kapha person has this tendency of gaining weight very easily, and since kapha sthana is basically is above the head, a person who is kapha is very prone to headache, is very prone to this sinusitis, to a very dull sinus pain. And they also have this weight gaining tendency. Either even eating very, very small things can make them gain weight. Apart from that, they have this tendency of retaining fluid, or fluid retention or water retention. So they kind of have this swelling that very easily comes to them. It can be, mainly seen in their ankles and breast swelling, which is very common in kapha women. And again, they have this tendency of excessive vaginal discharge, sometimes also associated with when there's an infection, or if there's excess discharge, and if they've not really done something about it, it can also lead to an infection, and it can lead to a foul odor. They generally have strong immunity. A kapha person is generally stronger than a vata or a pitta person. But when imbalanced, when there's a vitiation, they kind of fall sick just as easily as as the immunity gets compromised very easily. Now, these kapha people have a tendency of worrying a lot, and when they worry, they kind of eat a lot, and they have this tendency of feeding others also. So for a kapha person, it's always good to drink warm water. You can mix it with rose water, or you can mix it with some kind of a coolant and drink it. Sorry, not a coolant. You can have something that's warm. You can even have teas very often, because a kapha person, sipping warm tea will kind of help them. Any warm tea would help them. Now the thing is, because a kapha person is this kapha is basically water, right? So a kapha person doesn't really get thirsty that easily. So you need to kind of constantly remind them to have water. Whereas a pitta person would feel thirsty very often, and pitta people are people who normally tend to drink a lot of water, because they have that innate warmth in them, so they need that constant water. But a kapha person wouldn't really feel thirsty, and you need to kind of remind them to drink water. So this is a very natural, this is a very general classification of women based on the doshas. Now, this is something that I was telling you. This is a classification based on age. So from birth to puberty, you have more kapha dosha. So generally, this the onset of your puberty is normally between 9 to uh, 14 or 16 years of age. And depending on the dosha that your prakriti is, the your onset of puberty will kind of vary. So from puberty till about 40 years of age is called uvati, or that's the area, that's the phase when there's more pitta, when you're menstruating. And so that's more of a pitta phase. And then the next phase is from 40 to 50, which is generally your perimenopausal phase. So you have both pitta and vata. And then slowly the pitta kind of reduces, and you lean more towards vata, and that becomes your vriddha avastha, or the avastha which is menopausal and post menopausal. So this is how women, this is basically how classification is done, based on age and based on the doshas that are predominant at each phase. Now, like we already saw, the different cycles affect a woman's natural cycle, affects a woman's menstrual cycle. We'll see how in a bit. So in general, for a person to have a very natural cycle, these are certain things that are advised, like general meditation, eating food according to your dosha type, resting and doing absolutely no strenuous activities during your period, avoiding stressful situations and stressful activities during your period, and having herbs like shatavari, turmeric, punarnava, fenugreek, rose jam or rose water, and different kinds of yogasanas that can be done to help ensure that you're healthy, and there's enough support and energy that goes into your uterus. So different kinds of yoga postures are there. So generally the lunar, so this the whole cycle of a woman, the Artava chakra or the Artava cycle is normally called a lunar cycle. And in Ayurveda, it's called Chandramasa. So the entire month is divided into 3 phases, and then the doshas are kind of correlated to the phase. So simply because of the similarity with how you have 28 days in your menstrual cycle, and which is more or less equal to the lunar cycle, so hence this whole correlation came about. But the thing is, like how there are certain articles, and there are certain people who have really correlated how the waxing phase, how the new moon and full moon are related to your menstrual cycle. And there are a lot of articles about how full moon kind of means a woman is ovulating, and that is on the day of the full moon she is most fertile, and new moon kind of correlates to her being empty or not fertile, and how that kind of has a perfect and new moon is generally when she menstruates. So this is one whole concept, one whole side of the story. On the other side, there are a group of people who actually believe in exactly the opposite. So there have been a lot of debates, and there have been very contradictory researches that are done on how to correlate the lunar cycle with the menstrual period, and how every woman has a different menstrual cycle. So every woman doesn't menstruate on the same day, so there's a difference in how in their cycle, and there's a difference in the way their body is, and in all of that. So there are very contradictory researches, and I still have I still haven't really found a very convincing research paper from anybody who is actually explained this perfectly in relation to an Ayurvedic aspect. So the whole relation thing, as far as Ayurveda is concerned, is basically the correlation in terms of the number of days that the lunar cycle lasts and number of days that the menstrual cycle is. So there is an effect of the moon with a woman, of the moon with people. And there are a lot of Ayurvedic plants that are collected when it is, on the day of new moon, on the day of full moon. And normally full moon has a lot of energy and has a lot of positivity. So on the day of full moon, there are certain herbs that are collected, and those herbs have maximum potency, and that is used to make medicines and all of that. So that aspect of it has a lot of explanation. And there's a lot of there's a lot that's explained. And again, if you when you start doing dravya and your researches, you'll kind of figure out that it varies for every plant. So it's very beautifully explained. But not going off topic, coming back to menstruation, the whole physiology of menstruation, the ovarian cycle, the uterine cycle, and all of that is for you guys to do your homework and go through this. It's pretty easy to understand. So I'm going on to the Ayurvedic aspect because we have a lot to finish. So yeah. So the Ayurveda and menstrual cycle. So normally, menarche is around 9 to 14 or 16 years of age. And like I was telling you, based on the dosha that is predominant, there is, there's a difference in the menarche. So normally, girls who have a very hyperactive pitta, they hit the puberty much faster than a girl who is predominantly kapha. So a kapha prakriti, a kapha person would hit puberty slightly later than a pitta person. A pitta girl would start at probably 9 years or 10 years of age. In the olden days, this menarche was at 17, and then that slowly started decreasing with nutrition, with hormones, and with different aspects that came into the environment. So normally, this whole menstruation concept is like a very sacred, is a very is a very a very pure concept for women, because one, it is a natural way of eliminating waste products, of eliminating impure blood, of cleansing the body. Two, it is this menstruation which kind of helps a woman to bear a child. So in that sense, the whole concept of menstruation and menses is a very sacred concept. Now, on the first day of menstrual cycle, normally it would be light bleeding, and there's that feeling of tiredness and fatigue and all of that. So you ensure that a woman has complete rest during her menstrual cycle in order to recoup from that pretty well, and so that she doesn't really get tired and kind of burn out in the process. So this process of menstruation, during the whole process of menstruation, your Agni is normally very low. You have a very low Agni. So you need to make sure you eat food that is very light, and light food which will digest faster will ensure that you have the sufficient amount of energy and nourishment that you require from the food. But at the same time, that wouldn't lead to bloating sensation or lead to any of your doshas being imbalanced or vitiated. So in modern medicine, you learn about menstrual cycle, and we normally learn about the female hormones and how the hormones play an important role and so on. As far as Ayurveda is concerned, we look at the Artavavaha Shrotas and the whole menstrual cycle in terms of the Rasadhatu Agni, the Artavadhatu Agni, the Apana Vata, and the Poshaka Kapha. So these four entities kind of control the entire process of your menstrual cycle. And if there is a vitiation in any of these, that will lead to different sorts of menstrual issues. So normally, this day 1 of your period till day 5 or 6 till you're bleeding is the Vata phase of your cycle. So during the Vata phase of your cycle, this Apana Vata is what actually pushes out the menstrual blood. And a person who's extremely vata will have constipation during the process of menstruation, whereas if you're pitta and if you're extremely pitta, then you kind of have diarrhea. So the first day of your cycle till the fifth day is completely governed by vata dosha. That is the reason that people experience bloating sensation, gastritis, and so on, and pain, cramps during the period. From the fifth to sixth day of your cycle till the ovulation is the time when there is estrogen buildup in the body, and that is governed by kapha dosha. So you normally start, once your period is over, you start feeling hungry, you start having that you have this tendency of eating, and you have this heaviness, and this is a process when the uterine wall is thickening and your egg is maturing, right? After that, after you kind of reached that ovulation stage, from then on you have your estrogen starts reducing slowly and your progesterone starts increasing, and that is the phase when pitta kind of controls the whole process. And then once you've reached your 28 or 29 days, there's the sudden sharp dip in both estrogen and progesterone, and then you have your menses. So this is the menstrual cycle in Ayurveda, about how each dosha kind of plays an important role in the different phases of a menstrual cycle. Go through the physiology as far as modern science is concerned, and then if you're not able to correlate it with the Ayurvedic thing, you can post it on the forum and I'll explain it to you again. But it's kind of pretty easy to understand, right? So certain causes for menstrual imbalances. One, stress. Now, stress is the most important and most common thing that everybody goes through. Stress can cause insomnia, weight loss, irregular menstrual cycles. Sometimes, there's amenorrhea because of stress. Sometimes there's excess bleeding, hypermenorrhagia because of stress. It can lead to infertility. It can lead to, irregularity as far as your blood pressure is concerned. And if you're stressed during your perimenopause and menopausal period, then you have increased hot flashes and you have increased symptoms that are seen. The second thing that affects your menstrual cycle is stimulants. Like, it can be drugs, it can be diet that is inappropriate for your dosha. And for instance, if you're a vata person and you keep having vata aggravating food, or if you're a pitta person and you keep having only pitta type of food, that can kind of lead to an imbalance in your cycle. Again, if you have alcohol or caffeine, or you do exercises that are not right, that can all kind of create imbalances as far as your menstrual cycle is concerned. Poor nutrition, when you don't have all the 6 rasas, when you don't have a balanced diet. Emotions, when your mind is all over the place and you're anxious, you're worried, and you're not able to concentrate and kind of hold your mind there together, then that can lead to different kinds of imbalances. And finally, toxicity, alcohol, recreational drugs, or emotional toxicity, environmental toxicity, anything of that sort can lead to an imbalance. Now, this is something that's very commonly used and misused: premenstrual syndrome, right? Anybody who's going through a little dip, there are people who kind of ask a woman who suddenly, maybe if she's going through a bad day or something. It's a very common question for people to ask a woman whether she's PMSing. So in that sense, this word is just totally misused and used a lot. So premenstrual syndrome is something that normally happens when there is a fall of your hormones that kind of control your menstrual cycle, and that is the explanation that is given for in modern medicine. But this, in terms of Ayurveda, normally happens when your prakriti is of one type, and if if you kind of don't really do a proper ahara vihara regime to kind of control that to kind of, actually pamper your prakriti, that will kind of lead to that dosha increasing. Say for instance, if I'm a pitta prakriti, and if I am kind of eating food that is very pitta, and I'm kind of, I keep getting irritated, I get angry, I don't exercise, I'm not really taking care of my health, what happens is I start having hot flashes, I start having acidity, I start having that burning sensation, I start having terrible mood swings, because I've kind of aggravated the pitta in me. So then that, when it correlates with my menstrual cycle, I start having I start having very, very, very acute symptoms of what would happen during my period. And that is what we call premenstrual syndrome in Ayurveda. So to understand that, these are basically symptoms that are seen during your vata, pitta and kapha period, and that will also, these symptoms might also be there before you get your period, and in that sense that becomes your premenstrual syndrome. So for a person who is vata and who has a vata period, and when there's a vata imbalance, what happens is, your period becomes irregular. Now, it doesn't mean everybody who is vata has to have these symptoms. This is when there is an imbalance, right? So your bleeding is kind of, it might be a little less, and then you might not have it for some time, and then you might have an on and off flow. The blood is slightly darker and might be a little brownish. So a vata person normally has a shorter duration of a period. There's bloating, constipation, and there's all sorts of pain that you can see, low backache, pain in the hip, pain in the groin. There's stiffness in the body, and there's anxiety and restlessness. So these are very vata symptoms, but these symptoms can also, it can also be a result when, like, a pitta person has kind of, when if you have a lot of pitta, and if that pitta has burned out the vata, or if there's a combination of pitta and vata, then you can see these symptoms. So these are basically symptoms that are seen when there is a vata aggravation. So what you do for this is, you advise warm food, warm liquids, warm water, grapes, dates. You can use herbs like dashamula, a kashayam that's made with dashamula, or shatavari. Shatavari is a very important herb as far as women are concerned. Now, what happens when you have a pitta type of period? You have irritation, anger, hot flashes. People are prone to acne, sharp cramping. The blood would be bright red in color, and when there's excess pitta, there would be excess bleeding, and there might be a slight burning sensation also that happens when you have a period. Some people suffer from diarrhea. So what you do for that is, you give cooling kind of food, figs, melons. You can use chandana, shatavari, guduchi. And when it is a kapha kind of period, the blood is kind of pale. There might be a little bit of a sliminess or mucus discharge that is also seen. There'll be dull pain or no pain for a kapha person. But they would have sore breasts. They kind of have vomiting sensation or nausea. Lethargy, tiredness, that feeling of coldness, and heaviness in the abdomen, water retention, swelling that is seen. And just prior to your periods, a kapha person generally feels that they've gained some weight. So for a kapha person, you give food that's warm or hot. You use spices, eat food that basically pacifies your kapha, and you can use ashoka, kumari, ashwagandha, and so on. Now, normally what happens is, for a person who is just one prakriti and who has a normal menstrual cycle, they normally don't have symptoms that are they don't have a premenstrual syndrome, or they don't have difficulty during their periods, right? That happens normally when there's a combination of doshas. And the most common thing that is seen is, people might have might have sore breasts, might have might have vomiting sensation, might actually vomit, might have diarrhea, and severe cramps and severe pain and excess bleeding. So, which just basically means that there's a combination of all these three dosha symptoms that are seen, and that becomes dysmenorrhea, which is tridosha type of dysmenorrhea. So then you need to start doing things that would pacify each dosha based on, based on your symptoms. Like if there's severe cramps and there's low back ache, and there's severe pain in the hip and the groin, then maybe something like a hot water bag would help. If there's vomiting sensation, and if there's diarrhea and there's excess bleeding, so that means there's excess kapha as well as there's excess pitta. So you need to make sure that they're not dehydrated. So you need to make sure they have some sort of fluid which should either be warm, like maybe some tea that would help settle down the stomach and so on, right? So how do you prevent PMSing, or how do you even prevent these symptoms that happen during your period? The first thing would be to exercise regularly, any form of exercise that suits you. Pranayama, where you're concentrating on your breathing, and meditation, massage, regular massage and regular svedana that is done. Based on your dosha, you avoid doing things that would aggravate the dosha. If you're a vata person, you avoid doing things that would aggravate vata. You avoid grief, you avoid sadness. If you're pitta, you avoid arguing, you avoid getting angry. If you're kapha, then you avoid taking your day naps and so on. You avoid doing things that would aggravate the dosha, that would create a vitiation of the dosha. When you actually have your period, do not exercise. So you take rest and make sure that your body is takes that time to meditate and to completely take care of yourself. And based on your prakriti, you need to do whatever ahara vihara lifestyle practices that are required for your constitution. Avoid having caffeine, chocolate and alcohol. And normally, like I told you, this PMS is always a combination of symptoms. So you need to do things that would pacify all the doshas. And this is something that I believe in. For people who do have PMSing and people who do have mood swings and all that, you just need to take some time out and just pamper yourself. If you have people around you who will do that for you, then wow, you're lucky. If you don't, then you just need to take care of yourself and pamper yourself, and that by itself will take care of most of your symptoms. So yoga and menstruation. Now this is again something that different people have different they have different things to say about this. So there are some people who actually believe that you shouldn't do any exercise during your menstruation, which kind of includes even yoga asanas. Like I was talking about this recently when I went to Coimbatore for a seminar. We had this elderly gentleman who was talking about yoga and who was talking about different kinds of yogas that would help different parts of your body. And he said when you are on your menstrual cycle, when you're on your period, you don't do anything, because that is the time for you to completely take rest. So you avoid doing things that are like most of the people nowadays either have aerobic classes or Zumba or something that going to the gym or playing a sport. Don't do it when you're on your period, because you need to conserve your energy. Your hormones are very low and your vata is actually high at that point, right? So you don't exercise and further aggravate your vata, because that particular phase is your vata phase. Avoid doing standing poses or inverted poses or backward bending. So the main reason that the thing that he explained is that's the time when you need maximum rest, and at that point you don't want you're kind of trying to remove all the the impure blood from your body, and that's a natural cleansing process for women, which ensures that they have a healthy long life. So you don't want that blood which has to come out, you don't want that recirculating within your body, because when you do your yoga, when you concentrate on your breathing and all of that, you're kind of trying to, you're trying to ensure that your circulation is perfectly fine. And most of the asanas, you're trying to ensure that you activate that particular point, you activate a particular organ, and you're trying to supply blood to that organ. So when you are on your period, you try and not do that. Another thing that you have to avoid is wearing very tight clothes, and you just kind of, uh, like I said, pamper yourself, be comfortable, and take maximum rest during your menstruation. And then there are certain people who say, it's fine to do certain asanas during your yoga. So for people who kind of believe, see, this is just basically different schools of thought. So for those who feel that during your period, doing yoga will help you, then these are certain asanas that you can do when you're on your period, right? Like Uttanasana or Baddha Konasana or Virasana, or there are few asanas that you can do. But every asana that you do during your period, you need to make sure that you use support, and that you're not straining yourself, because you're already kind of weak during that phase, right? So apart from that, when you're not on your period, then it's a great thing to to do yoga, and to ensure that you kind of increase your the hormones, and you kind of activate that energy within you. So once you're finished with your menstrual cycle, you can you can slowly start doing your asanas. You start slow, and then when you've reached your ovulation phase, you can you can start practicing standing poses, sitting poses, back bend, inversions, forward bending, and uh, basically you can just do all the asanas that you do. Surya Namaskaram can be done, which kind of is like a nutshell of all the most important asanas together. So that's a wonderful asana to practice. Now, for people who who have who are going through a perimenopausal or a menopausal phase, for them, based on how strong their bones are, how strong their basic, how strong they are, there are asanas that they can follow also. Now, when you're closer to your period, generally women have bloating, and have this very dull back pain, and have issues balancing and so on. So when you're closer to your period, if you have such issues, then it is advisable to use support when you're doing your yoga. Like you use support when you're doing your back bends or your forward bends or your balancing asanas. If you don't have a problem, then you can go ahead and do your asanas just the way you do it. So now, coming to birth control, there are different methods of birth control as far as modern science goes, like pills that combination, having just progesterone only pills, extended release pills, IUDs, physical barriers, and so on. There are different kinds of birth control, but as far as Ayurveda is concerned, the birth control in Ayurveda, one thing that is followed is based on the menstrual cycle, based on your safe period, and so on. Apart from that, uh, there are certain pastes that are made from herbs and all that, and that is used, but not very effective. So I wouldn't really recommend that. Ayurveda has a very even back in the days, when these books were written, when these granthas were written, there were like natural contraceptive methods that were used, but none of that is really followed today. Apart from abstinence, that kind of works perfectly. So um, presently, the Ayurvedic study and all that, Ayurvedic physicians don't really, I mean, you can't really prescribe any of the pills, or you can't really prescribe a birth control method, right? So what we believe is these pills that have hormones, and these pills that are you're kind of messing with your body's normalcy. So you're kind of actually, your monthly period is artificial because there's no ovulation that happens. There are certain pills that actually kind of reduce the number of periods that you get, or it just kind of stops a woman's period. There are a lot of side effects that are associated with these birth control pills, like you have depression, anxiety, pelvic inflammatory disorders, certain high doses of medicines, and using these for a very long period of time can even lead to infertility, because there is no ovulation that happens, and then finally when you want to have a baby, it becomes difficult to conceive because of the effect of these hormones on the body. And at the end of the day, you're basically giving your body something that's artificial, that is not natural, which is not good. So you're basically affecting the prana and the apanavata, right? So that is kind of menstrual cycle. Now what happens after you deliver a baby, after your Ayurveda, that's postpartum? So normally after you've delivered a baby, there's a lot of vata aggravation because of the strain of labor. And there's a lot of significant loss of fluids that happens. There's a lot of gas and constipation, and that feeling of emptiness after the delivery. And of course, once you've had a newborn, there's your sleep cycle changes, your entire routine changes. So after your delivery, for a new mother, she undergoes various different kinds of emotions. So there's no rest. When she does rest, it's incomplete rest. So for a new mother, she has to make sure that she rests properly, she eats healthy food. She shouldn't strain and do excess exercise or anything that will further aggravate the vata dosha. And a new mother has to nurse her baby, because that kind of that's very important for her health as well as the baby's health. Make sure that she doesn't really worry too much about losing her body, her pregnancy weight, and because of the whole negative image that the whole negativity surrounding what happens when you put on weight. And people go through a lot of stress, and people go through a lot of anxiety just thinking about losing all that pregnancy weight, and a lot of stress that normally happens to a new mother. So how can you kind of help take care of these issues? First, you need to consider the doshic constitution. You need to see what dosha that the person has, the age of the mother. You can suggest healthy food habits, suggest basically the mother needs help from the family. So if you're counseling, you need to counsel the father also, and make sure that you're able to make sure that he is able to help her with her routine, and help her basically put her lifestyle back together, so that together with somebody's help, she always finds it easier to work on postpartum anxiety. So eat food that's fresh, that's warm, that's freshly cooked, something that has all the rasas. Otherwise, you add a little more of sweet, salty, and sour rasas. Food that's light and can be easily digested and doesn't cause burning sensation or gas or anxiety. Eat food at proper intervals of time. Rest as much as possible. Nap whenever the baby naps, and try and go to bed early. Regular abhyanga, making sure that she has a nice hot water bath. abdominal wrapping to make sure that there's no sagging of the the abdomen, and to ensure that all the organs are restored properly back right in the original place. Doing yoga and meditation, very very gentle mild yoga and meditation. And most importantly, a new mother has to nurse her baby uh, in order to make sure that she is healthy and the baby is healthy. If there is a problem with the milk, then you need to have food that you need to have warm food. Need add milk to your diet, ghee to your diet, coconut, cereals. You can even use ashwagandha, shatavari with milk, or fenugreek in the food. So normally with these with these small changes that you advise, normally you can bring down postpartum depression, and you can kind of help the mother combat postpartum blues. Now finally, perimenopause and menopause. So normally what happens is, once you reach that 40-45 years of age, you start seeing symptoms of perimenopause, like irregular menstruation, hot flashes, different kinds of the most common thing is irritability, and complete change in the kind of mood behavior pattern that a woman had previously. So if it's a woman who used to be very patient and used to be very adjusting, she just suddenly is not able to take that. She starts snapping, she starts showing she starts having mood swings and so on. Now there are different kinds of symptoms that are seen just based on what kind of dosha you have, like symptoms varying from hot flashes to vaginal dryness to retention of water, swelling, sudden gaining of weight, not being able to sleep at all, from being wanting to sleep all the time, lethargy, mood changes, and so on. There are different kinds of symptoms that are seen. So what you need to do is, even though your body is no longer menstruating, no longer have that menstrual cycle, your body is still kind of connected to the lunar cycle. So certain things that you need to do to help ensure that you can kind of avoid having most of these symptoms is, first thing is de-stress. You need to de-stress. So it can either be by practicing yoga, or by doing something that you like doing, inculcating a hobby, or just meditation. That will kind of help reduce stress, reduce fatigue. And when you kind of de-stress, and when you kind of have everything together, that will bring down your depression, your mood swings, and all of that. So ensure that a person who is in her perimenopausal and menopausal stage eats food that's vata pacifying, has freshly prepared food that's warm, has shatavari. You can either have it with milk, or just shatavari lehyam, or shatavari jam, or some form of shatavari. Pomegranate juice with fresh lime and organic sugar works wonders when a person has hot flashes. Apart from that, you're just basically eating food that kind of increases your estrogen and progesterone, like yams, sesame seeds, or soya bean, or tofu, things like that, walnuts, nuts, things like that, that will kind of help naturally increase your phytoestrogens, and that would naturally increase your hormone level. That will help in case of mood swings and depression and all of that. Now you can do yoga asanas. Like I have a patient who's 75 years old, and she does yoga every day, and my God, she's just unbelievable. But for a person who is not used to doing yoga, you need to make sure that you don't start a person who is like 55, 60. You don't start with asanas that are very difficult to do. if they've never done yoga before. So you have to consider their age, the attitude that they have, which is very important. You choose asanas accordingly, or you can just ask them to do just plain meditation and pranayama. You need to see the prakriti of the person and see if there is a dosha that is imbalanced, then you need to balance that out. And basically just some counseling about how they can make changes to their lifestyle and to their eating habits and their general exercising and all that. That will really help them quite a bit. And then the one thing that I keep telling, and the one thing that I really believe in, educating women that they need to take time off for themselves, they need to pamper themselves, and they need to really take care of themselves, not just in terms of physically looking good and having a thin body frame, and not that, but taking care of yourselves in the sense of being healthy, being fit, and feeling good about yourself. That is what is most important. I think fitness is so badly misunderstood today, where people are body shaming others, and women go through these phases when they start gaining weight, they want to lose weight, and in order to do that, they kind of do extreme things which can then later on backfire, and you can have side effects because of that. So with support, with that whole just with that good frame of mind, where you know that you want to take care of yourself and your body, i think um, I think that'll just make it very easy for a woman to combat different issues that she has during different phases of her life. So, do you guys have any doubts in what we've done today? I was trying to cover everything in 1 hour's time, so hence it kind of did sound like I was, do you guys have any doubts in anything that we did today? Yeah. You can go through the whole menstrual cycle in modern medicine, and if you guys do have any doubts and you're not able to correlate it with the Ayurvedic doshas, do let me know. All right. Thank you so much. Hope you guys enjoyed the class. Bye bye.